Perimenopause and menopause, how much calcium do you need to eat in your diet to make sure that you are avoiding bone diseases in the future?
Yes, so we're talking about bone disease. We mean osteoporosis, where your bones supposedly weaken as you get older, and this has been a big bone of contention, no pun intended, for the science community for a long time. This concern that as people get older, their bones start to weaken, and then you get fractures, they fall over, and it doesn't paint a nice picture. So we want to prevent this, of course, as we get older. We want to have strong bones. We don't want to be falling over. So calcium, yes, calcium is needed for your bones for sure. And obviously there is this, a lot of advertising out there. You've got to get lots of calcium in, dairy and all this kind of thing. Well, obviously we don't want dairy because dairy is not healthy for you. So where do you get calcium from? How do you get enough? Where do you get it from? The plant food. So fruits, vegetables, all these different kinds of things, nuts and seeds. And we also need to make sure we get enough.
Enough.
Yes.
But there is a but here, yes?
Yes,
So
there is a but here.
Yeah. You must get enough calcium.
You must get enough and from the right sources. So first off, you don't want to get calcium from supplements. Why don't you want to get calcium from supplements? Well, first off, there's too much. So you're going to get a big dose of calcium when you take a supplement, typically. And that's not good for your body. Having that big spike of calcium get absorbed into your bloodstream.
Not only that, science shows what? If you get too much calcium from supplements, you can experience heart attacks and strokes.
Heart attacks. So heart disease, we're talking about heart disease. Yes, that calcium can end up lining your arteries, which is not what we want. We want that calcium in our bones and in our teeth where it needs to go. So we need to get the calcium from the whole foods that we're eating. So you'll get it in the right amounts. And then your body's really clever because what it does, it absorbs and takes up the calcium it needs. And if there's too much, it doesn't. It just lets it out of the body. It excretes it. So it's really clever.
That's when you do it from plants, not supplements.
Yes, exactly.
So supplements are a no. Foods, base sources of calcium, yes.
Yes. So notice calcium supplements, definitely not calcium supplements. You need to get it from your foods. And when you do that, that's when things work properly. So how much calcium do you need to take every day to remain healthy and to stop things like osteoporosis? Well, looking at the studies here, it's showing us that we need to be getting around 500 milligrams or more every day on average of calcium. So it's really important. And you will see varying ranges in different countries. Some say you've got to get 1200 milligrams every day. Other places 700. And so around 500 and up within that range is going to be where you need to be.
That's what's been studied, and that's what's been proven.
These are what studies are showing, and we need to get that from lower oxalate foods as well, which is a whole other area. But make sure you're eating lower oxalate foods, and that's really going to help you with your calcium intake.
A lot of spinach, not so good. Yeah,
no,
so high
a lot
oxalate,
of chard, not so good.
A lot of chard, beets. That's foods high in oxalates.
So we need to be eating lots of different greens, so things like lettuces, different types of lettuces, bok choy, kale, these kinds of things. They're going to give you broccoli. They're going to give you lots of minerals and vitamins, and they're not high in oxalates. That's really, really good thing.
And also nuts, seeds, legumes, and fruits and vegetables. Orange juice is great for calcium, for example. So yeah, making sure that you're eating enough, and paying attention to the amount of calcium that you are consuming to make sure that you are achieving the right amount. And again, with plant foods, you can't overdose on it. Yeah, so you cannot overeat on calcium. With supplements, you can avoid supplementation. There are a lot of gurus in alternative community who will say you need to supplement with calcium, you need to take it with this and that. Well, that is not true, because we know from scientific studies that calcium supplementation leads to problems. So calcium supplementation can result in heart attacks. So no to calcium supplements. You need to get your calcium from food. If you enjoyed this video, then you will love the free masterclass we've created to help you balance your hormones, gut health, and weight issues naturally. Head over to our website and register now. See you there.